This is Ms. Gray on documentation. Documentation is a process that you're going to use a lot in nursing, because if you did not document your care, of course it was not done. It's just the key facts or key takeaways from this lecture is that documentation is legal. Your charts are a legal requirement. Documentation is a legal requirement for licensed professionals. The patient's chart is a legal document, whether it is electronic or by paper. There are key safety measures that you want to utilize when you're using computerized charting. Do not leave the client's chart up with the screen on where people can see it. Once you have finished charting, you should either turn off the computer or log out, so that no one can log in behind you and no one else can see the patient's information. Different facilities have different policies regarding computerized records. Just remember to look at the policies of your facility wherever you are. Client records have many purposes: to communicate with the interdisciplinary team, to plan the care, for auditing, for research, education, reimbursement. Facilities cannot be reimbursed if there's not documentation of the care that they provided. Documentation is also legal, and it follows. Your patient has a right to know what care is provided in case they want to, look at their records. The care that was provided and the care that they were paying for should be present and evident. There are many sources and kinds of records and methods of documentation. By 2014, all facilities that are getting Medicare and Title 19 funds have to be on computerized charting. So this actually, I'm just making you aware, since you are in facilities that have paper, some of them, and the paper might come in different forms, but really in another year they're all going to computerized charting. Computerized charting has the same elements that paper chart would have, and so it's more important to know the elements that are required in your documentation than to spend time on what kind of paper, what kind of form it is, because the forms are going to change. So there are pros and cons to computer charting versus paper. However, everyone has to go to electronic charting anyway, so it's kind of a moot point. The nursing process documentation validates the nursing process. It validates what the licensed professionals are doing at the bedside or wherever that nurse is practicing. So your documentation validates that there was initial assessment. The flow sheets validate the initial vital signs, the I&O, the weight. The nursing diagnosis validates, is in the care plan. It validates the patient, the nurse is performing care based on the standards that are expected of nursing. Planning. Documentation forms could be the critical pathway, the care plan. Again, validating that nursing process. And your progress notes and flow sheets show that the care that's been provided is ongoing and progressive in managing the care of the patient. Care plans, as I told you, come in many forms, and I'm not concerned about you memorizing the forms as much as it's just to understand that care plans are a joint commission requirement. If care plans do not exist, again, joint commission does not have to pay. And the joint commission is the accrediting body for hospitals. So if there's no joint commission accreditation, there is no reimbursement for Medicare. And with the aging population and the volume of patients on Medicare, it'd be very hard to stay afloat without getting Medicare funding. So We want to provide good care, but it's also mandated by organizations. So there are, again, many kinds of care plans, standardized, computerized, but the important thing to know is that care plans exist. They are a part of our nursing practice legally, and by the standards we must complete them and fulfill that. There can be in your documentation flow sheets. In your facilities, you'll see graphic flow sheets, vital sign flow sheets, INO flow sheets, nutrition flow sheets, hygiene flow sheets, ambulatory flow sheets, safety flow sheets. There are all kinds of flow sheets depending on where you work. Just be aware to become familiar with your facility and what they provide. Progress notes are pretty standard. There's an area in a chart or on a computer where you can write a narrative experience of what is going on with the patient. Long-term care documentation does have some special standards based on the government. Patients in long-term care must be seen every 30 days by a physician. They must have ongoing nursing summaries and a review of their care plan every month, every 30 to 90 days. The doctor must see the patient. Well, the doctor has to see them every 30 days, but the care plans must be updated ongoing, or they will not get paid. If the state comes into your facility and the care plans have not been updated, then they can be sanctioned, fined, or closed. So it's very, very important. Legal and ethical standards of documentation. Again, the client's record is a legal document. It can be requested in court. Factors to consider when we are charting: we always date and time our note. We always want to chart legibly, print well in computers. Remember that your documentation is permanent. Only use accepted terminology, and in many facilities abbreviations are no longer accepted, so you must check. You must have correct spelling and your signature and designation, which includes your name and designation. Always make sure that your charting is accurate, complete, concise, and prudent. Don't put any personal opinions in there. And you should be concise and to the point. No extraneous detail, because anything extra that you chart that is not necessary, if it were to go to court, could be questioned. So only put what is absolutely necessary. Also, so when we look at documentation, some of the documentation that we do is part of the chart, and some of the documentation that we do is just social or courtesy for the nurses to communicate with one another as they transfer shifts. Every piece is not a part of the record, but of the legal record, but the communication exists anyway. For example, change of shift report. I'm getting off nights, reporting off today's. I need to let them know what was going on with the patients, and so I'm going to give them a change of shift report. And these are particulars that you want to include in the change of shift report, so that that nurse can go on and pick up the care where you left off. Different forms, the concepts are the same: concise, clear identification of the care you provided. Another form of documentation is the telephone report. Sometimes when you're transferring a patient or discharging a patient from one facility to the other, you're going to have to give a report on that patient's status and care that was provided. And you want to be as accurate and complete, because they're taking the handoff from the patient's care from you. Telephone orders becoming a little obsolete, but in the event that you do have to do a phone order, these are the components. But with the computerized charting, they want the physicians to be accountable for their orders, and so typically they'll have to put them in themselves, and you validate them. but there might be an instance where you have to do a phone order, and then these are important components that you would want to have in mind. And then these are some nice guidelines from your book on telephone orders. Care conferences can happen, another form of documentation, particularly when patients are discharged or if they've been in the facility a long time. Many times they'll have an ongoing conversation with the family about how the care is going and what changes the family might want or the patient might want for themselves. So it can be ongoing. Nursing rounds is when nurses round the patient for safety at the bed and give report at the bedside and an update on the patient. It's not something that you're going to ever do in a nursing home because there are too many patients. Nurse rounds typically happen on busy med-surg floors or ICUs. So that's all for documentation. Please pay attention to the components needed in a record when you are charting. You want to make sure key components here, again for review, is understanding what a record is, understanding how to handle HIPAA as related to computerized charting and written charts. Understand the purpose of client records, very important. Understand that when you are documenting, why you are documenting, what you are documenting, and how the importance of documenting, and also the kinds of flow sheets. And please pay attention to why to long-term care documentation, and also the factors to consider when you are charting. These two slides are very important foundations for your future as related to documentation. That's all I have for today. Make it a great one and be safe.